the Affordable Meds program was born. Mary and I felt the best way to continue this program was to start a foundation which would focus on helping other patients in similar situations and also address other healthcare challenges many patients in our valley face. To get the foundation started, we felt we needed to select a leader who is compassionate, who has the ability to identify healthcare issues in underserved communities, and able to creatively develop programs that help address those needs. Danielle Colayco has all those qualities, so we asked her to be the executive director. Danielle has a deep commitment to patient care and a calming manner when she talks to patients, a sensitivity for underrepresented groups, which in this valley is the majority of our patients, and the creativity to develop new solutions that can make a difference in their health. She also has a background in pharmacy research that Mary and I felt would allow our foundation to measure the impact of the program we develop, and also to set an example for others to follow, other pharmacies to follow. Once Danielle agreed, then we set out to find board members who had that same commitment to community and desire to improve the lives of patients in underserved areas of our valley. The board members provide Danielle and our foundation the guidance and advice so the program we create have the most impact with the limited resources available. And they also help us find other resources. Our board members are distinguished leaders in the pharmacy profession and also in the community. So let me introduce a few of them to you today. I'd like Dr. Wilma Wong, distinguished alumnus of UCSF School of Pharmacy, and also she's the California Pharmacists Association Hall of Fame. Tom Collins, CPA, a UCLA alum. We won't criticize that, at least today. And our accountant from the beginning in Delano, so when we started in Delano. Three others that are not here yet. Hernandez, who's Deputy Director of Government Relations and Strategic Development for Kern Health Systems. And we've known Hernan before Kern Health Systems. He was the Executive Director of the California Farm Worker Foundation, who we worked with our foundation. Also, we have Dr. Stephen Chen, Associate Dean at USC School of Pharmacy, and was recently awarded the California Pharmacists Association's Pharmacist of the Year. The final board member is Don Kishi. He's Professor Emeritus from UCSF School of Pharmacy, and he also could not be here today. These board members are recognized and respected throughout the country. And with our leader, Danielle, has taken our foundation farther than Mary and I originally thought was possible. I would now like to turn it over to our Executive Director of the Komoto Family Foundation, Danielle.
Thank you, Brian, and thank you, Mary, for entrusting me with kind of guiding the direction and the operations of your foundation. It's been an honor to lead this organization for the last decade. I can't believe that I'm saying that right now. And before we kind of jump into our presentation, which will highlight a few of the things that we've been working on over the past 10 years, I want to acknowledge that the Tachi Palace, where we're holding our beautiful event today, is owned and operated by the Tachi Yokets tribe, whose ancestors are the original stewards of this land that we're occupying now. So thank you so much for the hospitality and for allowing us to use your beautiful facilities to the tribe. I also want to acknowledge that today, October 5th, we're actually at the intersection of Hispanic Heritage Month and Filipino American History Month and LGBTQ History Month. So lots to celebrate. Now I have to put the mic down, and I can't control my slides from here, so. Okay, yeah. So joining me up here, we have Sandra Hernandez. She is our community program coordinator for the foundation. Stand on this side. On the other side. Thank you. So go ahead. So I want to take a moment and introduce the team of people that make all of this work possible that we're about to tell you about. So first of all, Sandra Hernandez. Amy Flores, our community program associate, and Consuelo Robles, our community outreach liaison. So this is the dream team. They're the ones that make all of this work happen, and I am so proud and so appreciative of all of you. So our mission, what we're all about here, is promoting health equity. That means fair access to health care to everybody. In partnership with our under-resourced communities around here, and we focus particularly on pharmacist-provided care. Next slide, please. So our work can be classified into these three different buckets, which are outreach, research, and education. Next slide. And at this point, I'm going to hand the mic over to Sandra, who's going to tell us about our Affordable Meds program, which is really the cornerstone and how it all started, as Brian described to you.
Hello everyone. So the Affordable Meds program, that's part of our outreach work. And this program, as Brian mentioned earlier, it was created to help patients from low-income, underserved communities who are either uninsured or underinsured and can't afford their expensive medication therapies. So there's a lot of programs out there, right? But a lot of our patients don't know that they exist or how to navigate them. So I, alongside with Consuelo and Amy, we help our patients by looking for the appropriate program. We also do the paperwork process, and then we do the follow-up that comes after they've been approved to make sure that they're obtaining their medications. So that was a quick overview of what our program is and how it works. However, I would really like everybody to understand the impact that this work has on our patients. So for that, I want to share a quick story that is forever near and dear to me, and hopefully I don't cry, but if I do, I'm sorry. So a couple of years ago, I had a patient that was referred to us for 2 medications that were costing her about $2,000 a month. Her and her husband were just living on their Social Security benefits, and unfortunately their HMO plan wasn't really covering those meds. To make matters worse, this patient had just received an organ transplant, and one of those medications happened to be for that. So as you can imagine, I felt a lot more pressure to try to get her this medication covered. Thankfully, I looked for available programs, was able to find some, and we did the application, and she was approved. She got the medications at no charge to her. So, of course, I made the call, and they were extremely happy. And I thought, that was that, right? I'll just follow up with them in a couple of months just to make sure that they're getting their refills. So, a couple of months later, I get called to the front of the pharmacy, and they said that there was somebody here looking for me. So I go up there. When I go up there, I don't recognize this patient. And of course, it's awkward, like, oh, hi, how can I help you, And so she's like, hi, Sandra, like, it's me. So it turns out it was the same patient that had just helped out, except that the reason why I didn't recognize her was because initially when I had just helped her out, she looked completely different. She looked very ill and frail. And needless to say, she just didn't look well. And the majority of the time I was in contact with her husband. But this time she looked, healthy, full of life, you know, and I'm not exaggerating, it actually looked like she had aged 10 years backwards. And I had to apologize to her. I'm like, I'm sorry, but you just look really good. And she said, well, that's why I'm here. I'm here to, you know, thank you in person for the help that you have given us. And, you know, she had also given me a little gift, which was a little bonsai tree with a letter that just expressed their gratitude for this work. And I just want to say that we don't do this type of work for those gifts. Sometimes our patients just feel compelled to do so. But those moments make you realize that, you know, these patients, we're not just there, you know, maybe there's times where I was guilty of this and I thought, oh, but I didn't really do much. I just, you know, got your medication. You know, I'm sure Consuelo and Amy, you know, when you make your phone calls, they're so appreciated. But to them, it's much more than that. You know, to them it's like, okay, today I get to take my medication and I get to pay my rent. Or today I get to take my medication and I get, you know, to have groceries this month. So we're doing much more than just getting them their medications. It's literally, we're giving them a big part of their life back. And I can honestly tell you, I knew it. I can stand up here and tell you that we are really proud of the work that we have done with these patients. We need this work and it's important that we continue to do it. And as you can see, these are some of the patients that we have assisted throughout the years. However, we have assisted over 3,550 patients, and I want to quickly note, these are not just patients in our local communities. These are patients throughout the Central Valley, even in LA. That's thanks to Avina for referring those patients to us. We are reaching more communities. And we have saved a total of 5.4 million savings to their patients' out-of-pocket costs. And again, I just want to emphasize, these are not savings to the foundation or to the company. These are savings to patients. And this is due to all the shared efforts that we have as a whole, as a company. So I just want to say thank you so much, and let's continue to do this.
So you can imagine how proud I am of our entire team for doing all this work and having this incredible impact on patients. And I'm equally proud of all of you who have been a part of this success. So every time one of you looks at a copay and says, you know what, this seems a little bit high, let's see if we can help. And you pass it on to our team to see what they can do. All of that, all of those efforts are part of this. So I want to give a round of applause to all of you for being part of this. So some of the other work that we do is in the area of research. So as Brian mentioned, in addition to a pharmacist, I'm also a health economist, and we've done some collaborative research with USC over the years to look at the impact of what our team does in terms of the impact to patients and making their lives better, and also savings to the healthcare system. So these are some examples of a few of the peer-reviewed papers that we've had published in scientific journals. Many thanks to Paula and Jonathan for volunteering to model these lovely pictures of the Avina team. So for those of you who don't know, the Avina Health team, who's located in both Santa Clarita and Bakersfield, this is a call center of team members who they don't dispense any medications. They provide services to patients who are recently discharged from the hospital. And as many of you know from maybe personal experience, when you get out of the hospital, everything's a mess, right? There's a lot of chaos when it comes to your health. There's a lot of chaos when it comes to what your medications look like. You know, you might have like 10 new meds from the hospital and you have your 10 old ones from home from before. And so what they do is they sort through all that chaos and they bring order to it. And they make sure that if there's a problem with the medication that it's sitting at Walgreens needing a prior auth, that actually goes through. And they're helping facilitate all of that. They're identifying, oh, the prescriber did this inappropriate, prescribed an inappropriate dose. We need to call them and get that fixed. That's what they're doing. And so the research that we've done has shown they are effectively preventing patients from going back to the hospital. They're keeping patients well, they're keeping patients at home, and they're saving money to the healthcare system. So that part is what gets the attention of the insurance companies so that they feel motivated to pay us for the services that we're providing so we can continue to do this work. So we also like to highlight the impact of community pharmacies. So our community pharmacies in Delano and Bakersfield are access points for care, for preventative healthcare services, whether that's immunizations, birth control, naloxone, all diabetes services, asthma services, all kinds of things. So also very important thing to highlight. Next slide. And over the years, we're very proud of the different collaborations that we've had with different community-based organizations and educational groups. So many years ago, thank you to Liz for making that introduction to the California Farm Worker Foundation. Back when Hernan and I were sitting in that room wondering, hi, nice to meet you. We don't know if we'll ever work together in the future, but it's nice to make this connection. We never could have imagined that 8 years later, we would have a global pandemic and the farm workers would need vaccines brought to their workplace. And so that's what we did. We were able to bring the COVID vaccines to them, to their workplace, and collectively, between our two pharmacies and with all of the patients that we vaccinated, we were able to deliver over 11,000 doses of COVID vaccine. So we're very proud of that effort. And we continue to do outreach events with them. We've also connected with our local K-12 schools to talk about what pharmacists do, as a profession, and kind of plant the seeds, right? Because we know in the Central Valley we have a shortage of healthcare providers of all types, including pharmacists. And that's a problem because that means that patients can't get care. And so what we want to do is start planting the seeds in these young people's minds to think, if you're into science and you're thinking about a healthcare career, pharmacy may be something for you, right? So that we have more of our own homegrown pharmacists and homegrown physicians and homegrown nurses that are going to be here and stay here and be able to take care of our community. We've also collaborated with Bakersfield College, with CSUB, so you can see a few examples of these events that we've done over the years. And then some of you guys might have seen our coloring book called Who is My Pharmacist? So the way this started was Audrey, so you know Audrey, she gave you your drink ticket today. So that's my daughter right there. And when she was in second grade, her teacher invited us parents to come into the classroom and talk about our jobs. And my first thought was, how am I going to talk about being a pharmacist to a room full of 7-year-olds without putting them all to sleep? And so I thought, okay, let me bring something that's like fun and interactive, something that they can take home with them. So I Googled pharmacist coloring books. And what I found was books that talked about pharmacists selling medicine out of a store. Is that what a pharmacist is about? Is that what our profession is, selling pills? No, absolutely not. So what I did was I made my own coloring book. I wrote it. I hired an illustrator to do the drawings because I can't draw. And so I brought this into her classroom and they liked it. So fast forward, like a year and a half later, we now have it in 10 different languages. And thank you to Alma, Consuelo, Maria, and her daughter Leslie for helping us translate the Spanish one. We've been able to distribute over 7,000 copies of this book in the last year and a half. So if you don't see your language represented here, actually come up to me tonight, please, because I want to collaborate with you and make a translation of that. So make sure before you leave tonight, visit our swag table right there. Get yourself a copy of the coloring book and get yourself, we have stationery for the foundation. I don't want to bring that stuff home with me, it's heavy, so take it, okay? Bring it for your kids, your nieces, nephews. All right. Okay, and I want to end on a note that I'm super proud of, and I know Mary and Brian are really proud of. So we have been working on this for many, many years. I've been talking about how we need pharmacists who are from the Central Valley to be practicing and serving our community. We're not, it's nothing, no shade against LA and the Bay, but it's really difficult, when you try and recruit somebody from out of town, and, we just don't know if they're gonna be committed to this community in the long term. So, to kind of supplement that, we want to have more homegrown pharmacists. So we're starting a scholarship program for residents of the Central Valley who are going to pharmacy school to become a pharmacist. And so this is something that we're very excited about, and we're going to be rolling out the applications very soon. So thank you all for listening, and enjoy your dinner tonight.
Thank you, Danielle. Let's give Danielle the amazing work that the foundations do. Okay, so on your table is a pumpkin.